A chemotherapy is nothing but medicines, as like any other pills. It may be injectables, delivering through various routes under the skin like a insulin or a IV. A chemotherapy is a medicines which is acting on the both multiplying cell, whether it is a cancerous or the latest advances is like a CAR T therapy, something is that. That is also a immune based therapy. Your immune cells, the patient immune cells are being taken out, genetically engineered outside, and then given back to the patient so that your own immune system will attack the cancer cells.
Thank you so much, Doctor, for having a conversation with us. I'll give you a little background about myself first, so that you know where the conversation and how the conversation is going to go. I have not looked at a science textbook after the 10th grade. So I have no idea about what we are going to be talking about. I have a set of questions which I'm going to be asking you. Very basic things for you, it will be, but for us, it might sound very complicated. So we would love for you to simplify it and make our audience understand those complicated terms.
So it will be easy for me also to public perception will be easy because you are talking as a representing the public.
Yes.
So the questions will be like a public perception. It'll be easy for me to also address it. What are the basics to be looked into that?
Yes, yes. We don't have.
That will be nice.
Yeah, that'll be nice. I hope you have fun also while we have this conversation. Okay, so my first question. Imagine a 12-year-old kid. He comes up to you and he's like, Doctor, I've been hearing this word cancer around me all the time now because one of my uncle has it. Everybody's freaking out. Everybody's going crazy about it. People are sad in my family. What exactly is happening to my uncle? What is happening inside his body? What would you answer that child?
Yeah. So in our body, all our organs, which are made up of cells, each cells have unique function. There is a programming, it like a computer chip. It will be lived up to its expectations. If anything goes wrong, there will be an internal control which will be checking points where cell will go for the death. That is called apoptosis. There is a programmed cell death when things are not going in the right directions. Then this control is lost through various reasons and some genetics, through the interplay of the genetics misbehavior.
So you're forgetting that you're talking to a 12-year-old.
So the various reasons may be there, which may be from running in the families, whatever the reasons, or because of the infection, or because of the outside world. So that also many factors are playing a role. So that what will happen is one cell will have a potential to multiply without any control. So it started multiplying. So when cells started getting multiplication, it could behave like the cancerous process. Now, it can go for the continuous replication process, differentiation, redifferentiation process, and it may not be controlled by our natural immune system. So it will evade the immune system. Because our immune system will have a checkpoint. Okay, it can be controlling the any growth which is happening. So because of this, the cell will have the potential to grow, and it will multiply. And depends upon the area where it is, it will have a representation of that local symptoms. That is what the person will be.
Okay.
So that is the thing. So most of the time, the cancer is not necessarily that the connotation is cancer means incurable.
Okay.
It is not necessary.
Okay.
Cancer, all the cancers are not curable. There are some cancers where the screening is available by which it can be prevented before cancer is occurring. There are some cancers, if you find out at initial diagnosis, you can completely cure it. So some cancers which is at late diagnosis, or some cancers which cannot be curable, can be controlled for some period of time. Depends upon which modality of the treatment we are going for that.
Okay.
Exactly.
All right. So this child now comes to you and says that I heard that acute leukemia is what his uncle is having. So can you break it down for that child and for us what acute leukemia is?
Absolutely. So in general, when we say acute, it meant for the rapid growth. It's happening probably within a 2 to 4 weeks. The insult started within this 2 to 4 weeks. Leuk means white. Emia means the blood, whatever is happening in the blood. So white cells problems in the blood, it's called leukemia. That means it's a cancer of the white cells of the blood. Okay. So the blood cells are three cells elements are there in the blood. One is called the red blood cell, which makes a red color to the blood. Another one is a white cell from where the cells are coming for the cancerous growth is happening. Third one is the platelets are low. As you are aware that dengue fever, platelet is low, something everybody is telling. So this absolutely you're right. So these are the three cells are making the blood component. So these cells are coming from the bone marrow. So if there is any cancer that is happening in the blood, which is originated from the bone marrow, then the typically word called leukemia is applicable.
Okay.
So if it is happening within 2 to 4 weeks, that is where we say that it is acute leukemia. That is happening.
Right. Now, it is, I've heard this, and correct me if I'm wrong, but this kind of cancer affects children more than adults. Is that right?
Usually not,
Okay.
because in a case of children, cancer is not that common problems, but it does have a problem. It has a curable potential. The reason may be different from the cancer of the adults.
Right.
In a case of children, there may be immunity problems. As I mentioned you that one of the immune problems that the child can, or it can be a genetic mutations which is happening within the cell. Because of that, it can happen. Whereas in adults, because of the ecosystem affected, there may be infection or some sort of, we know that petroleum products, radiations, chemotherapy, so many things we are exposed to all these things, benzene or chemicals, whatever the reason that can be the reason for developing the cancer, the cells is getting the potential to multiply and going for the cancer.
Right.
So in a case of adult, we are all exposed. As the age increases, we are exposed to the external world and all the hazardous material we are exposed either from the genetic point or from the outside our the system. So all these things can contribute. So adults, it is more common as far as cancer is concerned. Of course, leukemia is also one of the cancers which can happen in the adults, and that is also more common in adult than the children.
Okay. Now, what are some of the symptoms that we can look for when we are talking about acute leukemia?
Exactly correct. So you typically mention that papaya in the context of low platelets, and you asked leukemia, which we discuss white blood cell problems, and effectively, and I told you that red blood cells. So any of the cells, whether it is a platelets or a white blood cells or a red blood cells, when it is affected, so it is going to have the symptoms of the same, which is causing the problem.
Right.
The person can have a low hemoglobin, which is a red blood cells.
Yeah.
Because of that, child will be tired unduly and easy fatigability. It is always lethargic. Attention span may be less. And we thought that, okay, you are overexerting or you are playing too much in a case of children, or you are working hard. That see, all these things we try to attribute to the other things. In a case of white blood cells problem, they are more vulnerable to infections because their immunity is low. So they are vulnerable to infections. In a case of platelets, its only function is to prevent the bleeding. So they can present with the bleeding. Depends upon the severity of the platelets, they can present with the bleeding. So a person with a leukemia, because the normal cells are getting affected, so the reflection is they may present with a anemia symptoms, or they may present with the infection because of the blood count is low. Or at the other extreme, when the blood counts are very high because of the excess multiplication, they can present with a problem in the brain, problem in the lungs, something like that. Or because of the platelets are low, they can present with the bleedings. So any of the symptoms can present. It can be not unique all the time. All has to present with all the three symptoms. It varies from person to person. Individualistic variations can be there. Depends upon the one particular symptoms.
Okay. Now we'll talk about children first and then go to, older adults. As you said, with children, we cannot really put a finger on the things because they are running around, playing, falling, bruising, right? They're going to school, they're meeting so many children. Fever is contagious. I mean, infections are contagious. They're getting fever. How do what is the point at which we should be like, okay, this is getting a little serious and we need to, go to take the next step?
Absolutely. So the first thing is for acute leukemias, there is no screening test. Unfortunately, there is no preventive test like that. So when we started noticing something unduly it is happening, or we thought that it's happening, but it is happening on a recurrent basis.
Okay.
Getting a viral infection is not that uncommon. Everybody can have it a day or two, couple of days, they are all right, feeling better. But the tiredness may be lasting for a week or two sometimes. But the tiredness is persisting. And the bleeding bruisability, as you rightly mentioned, which is increasing in frequency, severity, probably that must have been alerted. The child, same child which was having a bruisability, but which is stopped and then it is recurring and then it is increasing, probably we need to address it. A child who is otherwise well suddenly developing infection needs to be hospitalized for no reasons, and the infection is perpetuating and it is getting severe need to the need of higher antibiotics, intravenous antibiotics. Probably something is more serious. We may have to look into in depth
Okay.
what's going on.
Okay. So what is the time, or what is the, one particular thing that as a doctor you would look at a child and be like, okay, parents, you need to now take this to the next level?
Absolutely. So the first thing is, always in our medical text, they will say that history is very important. You have a basic history from the parents will tell beautiful history. Never ignore the parents of this one. They will say beautifully in a case of children. In a case of adult, they may not be educated, but still they will narrate what has happened cohesively. That will lead us to where we are going, what to do next. And that is the thing. History is very important. Second best things, which most of the time we are forgetting, is a clinical examination. Thorough checkup. Look at every system of the body. Look at start from the eyes to the mouth to the nose. Everything you look at that this one, then you can clinch. Where are we heading? Is it something clue giving a clue to lead the direction? Then, as you rightly mentioned, do the simple basic blood test. That will give us an idea. Is the count is very alarming one, or it is going up, decreasing, something like that.
So it's a simple blood test, nothing.
Simple blood. Most of the time, it will give us a results. But sometimes the counts may not be that much
Higher or lower?
higher or lower, marginally lower. But you feel on the examination you are finding something which is not normal, or the history wise you feel that something is going wrong which is not tallying with the findings. Then in that case, you will go for the corroborative test
Okay.
in the blood.
Okay.
If nothing is giving a clue, but things are persistent for lasting for a more than a month, something like that, probably you end up in doing the bone marrow testing, because there's a factory where the cells are coming out. As I mentioned to you that there is no prevention, in the sense when we say prevention, there is a screening test may be available by which you can early detect so that you can do that. But in a case of leukemia, there is nothing like a screening test.
Yeah.
There is nothing like that. As you rightly mentioned that the symptoms we are looking for, whether it is affecting the red blood cells or white blood cells or the platelets, and the effect of that, which is representing in terms of the bleeding or the fever or the tiredness, which a combination of three, one of these two, all these things will make it the patient presenting to the clinician with a possible, so-called ominous, the word that looking. There is, when you know everything, then you should schedule accordingly for the good, healthy lifestyle.
Right.
It's not only in the context of the blood cancer, acute leukemia, it is for your normal, every system of the body. It's not only the cancerous cells, heart, lungs, liver, kidney, every system has to have a organized way of working. So every system has to give a proper treatment for the same. It's not the mind only has to be given everything this one. So musculoskeletal is that you give a work for that. Do the exercise. That will be enough. Kidney, you need a proper purification system. Have a good amount of water. Having aeration exercise for a clear inhalation of a good air for a purification of the lungs. Everything is required. So every system has to get the best of it, like what you want the best of it.
Yeah.
Like that.
Now my question about hematology. I've been told that hematologists are very less in number in India, and even internationally they're very less in number. What makes you very rare? What makes doctors like you very rare?
First of all, after finishing my post graduation, I would like to do something new field where I can do something different. And that is where the stem cell transplant has come into the picture way back in 96, 97. Then I thought, then the degree was started in 99. I was a second batch in all India. So in fact, I'm the first qualified DM person in Kerala.
Oh.
To reach Kerala after my DM, I was first person throughout Kerala. Even though there are my teachers, hematologists, but they are all they were teaching.
Yeah.
So the qualified person, I came here way back in after finishing in 2000. I came here. That is the things. So that's where I continue. I loved my passion of my subject and this one character. So I just continued. This is what. Now there are a lot of almost 25 years. How many hematologists might have come? As you rightly mentioned, this degree has started recently, only last 20 years, 25 years. So because of that, the number of seats will be less, but it's slowly increasing. There are a lot of fellowship programs are there, uh, a lot of DNB programs, something is there. But definitely, as you rightly mentioned, compared to the medical oncologists, hematologists are less, but it's increasing. Now it's our facilities are available, all the things. So in Kerala, in every major cities, it is available. Probably your point is well taken. Probably when you go inside, the hematology service is not that much available.
Yeah, they are very less. So you all are very rare, is what I've been told. And this is what makes you rare.
Correct.
Yeah. But I want to know about you. When you diagnose a cancer in a small kid or maybe an elderly, what is it that a doctor is going through at that point?
Yeah.
Are you all desensitized to it because you've been seeing this for a long time, or does something
Yeah,
die inside of you also?
yeah. I will not totally refute that desensitization. To some extent because we are seeing day to day because that is our only profession. So that is the things. But at the same time, we need to have a attachment with a patient for so many reasons. One, as the time passes, we will have a bonding. But at the initial, when the diagnosis is being established, the bonding is not yet established because I need to convince him in their own language, in their own way of understanding, which makes them comfortable to continue the treatment in our center or at least to the center where they are going to get the treatment because finance will come into the social security, all these things will be social psychosocial addressment has to be there, all these things has to be considered. So most of the time whenever the diagnosed part is also easy, before the treatment the communication to the patient and the bystanders or the caregivers is very important so that they will be emotionally labile. It's quite natural that in sometimes it is in the word called incurable. When we will be telling them, we may say that it is curable, but their one question can be, can it be 100% curable? The word cannot be say no, but we need to say how can we do that. So that is so many factors will come into the picture. So it's not a one time communication, periodical, as and when necessary, making the communication to understand them till they are accepting that all the queries have been addressed. That to build up the bond, confidence, yes, we need to go through that. That is the
Can you share with us some case that is close to your heart? Maybe a survival story that you didn't think
thing.
would make.
I still remember a case referred from Regional Cancer Center Trivandrum with a lymphoma like leukemia cases. Child completed the treatment probably in the month of October some years back. And by November, the disease has come back. And the child has come to us. The child had the disease was in a high burden and child needs to be admitted in the ICU. I never hoped the child will come out of the ICU. Somehow our expertise team were able to manage it. This has happened during the COVID period. So that is the things. I can say that one of the best treatment will be provided on the RCC. That is the thing. But the disease biology is the one. It is not the treatment part. It is the biology of the disease is so high risk. So it will come back. Even whoever has given the disease can come back. That's sort of the biology. So when they came to us as a part of the possible transplant. So I was also not keen on taking the patient with a turmoil, going to the ICU and other thing. Patient was so sick. Somehow I have to do it is my job. I have to do that. There's one hope which we can do it. So all went on smoothly. Fortunately, even though it is not a fully matched, off matched, but then transplant went on smoothly. Little bit of complications. Now the child is 5 years old, doing very fine. It's a lot of transplant like that, which makes me happy. But this is the one thing, when the child came to us, need to be admitted in the ICU, then I thought, is it necessary to go for the transplant? But parents were, we can proceed. So that was something which is still lingering me. That okay,
That has stayed.
no, do not lose the hope. You do your best to the patient in your consensus knowledge, that will give the best result. You may not be able to satisfy some of the patients, some of the caregivers, but what is good, never go for the shortcut.
Okay.
Sometimes they may not continue the treatment here, but explain everything in details, make them to understand. You do not take the decision, take a shared decision. Even if they are not educated, you try to make them to understand, to try to get the decision makers making. Then you help us to make the decision. You do not take the decisions. That is always there, because they have to know the consequences of the treatment. That is what.
Consequences of the decisions that they are also going to.
Correct. That is what I'm saying.
Right. Coming back to the treatment, doctor, I will tell you what I think when I hear the word chemotherapy. It's a big word. And what I have it in my mind, because I've never seen it happening to my near and dear ones, I see huge machines. I don't know why, but I see, because of the big word chemotherapy, I see huge machines, a lot of wires going down my body. How different is chemotherapy from what my thought is?
Yeah. A chemotherapy is nothing but medicines, as like any other pills. It may be injectables, delivery through various routes under the skin, like a insulin or a IV or a muscle, whatever the various preparation ways, or the tablets, just we need to take it by your mouth, all these things. Chemotherapy is in general basically medicine which is acting on the cells which are multiplying. That multiplication process within the cell, or which is that. So a chemotherapy is a medicines which is acting on the both multiplying, any multiplying cell, whether it is a cancerous or a non-cancerous. So when it is a non-cancerous, it's our own normal cells. So because of that, you are getting the side effect. One side you are getting the effect because of the effect of the chemotherapy, what we wanted. Another end is because of the side effect where the multiplying normal cells are getting affected. So that's why you are getting it. So we need to talk to them, which are other system, depends upon the medicine. Some may affect the eyes, some may affect the GI tract, that is this one, or sometimes they may have the skin changes. So we need to address
Losing hair, which we
losing hair, all these things. All these things will be a temporary phenomena. How long it will be there, how much is expected, when it will come, when it will go. Everything we need to tell them that, so that they will get okay. I was expecting after 3 months, after that it will go away. So they can mentally prepare themselves. So all these things we have to say. So basically, a chemotherapy is a medicine as like any other medications. Various forms are there, various routes are there, various dosage schedules depend upon what cancer type it will be given, and it will be delivered, and the stipulated, there are schedules are there, because it will be even by chemotherapy cycles, like the schedules are there. So we will be given as per the condition of the underlying condition, the treatment will be scheduled accordingly, so that the patient will be addressed. The complication which is anticipatory, which is also persistent, and the delayed occurrence, all these things we need to talk to them, so they will be made prepared in a better way.
I'm sure you get this question very often, but how effective is chemotherapy, and how probable is your recovery?
That is where I'm saying. So if I say I'm being a hematologist, when I'm treating acute leukemias, I will go with the risk stratification. I'll be, when I am starting the chemotherapy, I will tell this is what the duration at which it is given, and the toxicity will be lasting for this one. Efficacy will be assessed after this time, and based on that, we need to decide what next treatment. Sometimes we may have to go for a bone marrow transplant. So because having said that the disease risk stratification is very high risk, probably it may not be able to be controlled by chemotherapy alone. So we need to go for the permanent solution is a sometimes stem cell transplantation. The latest advances is like a CAR T therapy, something is there. That is also a immune based therapy. So your immune cells, the patient immune cells are being taken out, genetically engineered outside, and then given back to the patient so that your own immune system will attack the cancer cells. So these are the various systems which are available nowadays and which are well. So chemotherapy is one among the treatment that is called immunotherapy, that is called radiation therapy. All these things are there. And then modalities like a bone marrow transplant, CAR T therapy. So many modalities depends upon the risk stratification, response to the chemotherapy or the immunotherapy or a combination, all these things.
So there is no one particular answer.
There is no one. We can talk to one particular when you address one particular cancer. Okay, that particular cancer, what is the type, what is the risk? Based on that, we can discuss. Since we are discussing a leukemia in general, so that's a reason.
Okay. So the next thing that I was told that happens if chemotherapy doesn't work out is BMT,
Yes,
bone marrow transplant. Can you talk us through that?
definitely. So conventionally, some 3 decades ago, we thought the stem cells from where our normal blood cells are coming, we thought it is only in the bone marrow. And that is why the word called bone marrow transplant was there. Now we know that the same stem cell is there in the blood also, but the amount is very less. So we can increase the amount by various injection. Mobilization agent is there. Mobilizing agent is there by which we can increase the stem cell from the bone marrow to the blood. So that is called peripheral blood stem cell. So now it is convention is changed from bone marrow to the stem cell transplant. Word called bone marrow transplant has changed to the stem cell transplantation. Now the coming to the stem cell transplantations by pushing the various injection, as I told you, mobilizing agents. The donor can be own brothers, sisters. It is called match sibling. If it is fully matched, we will be looking at various matching parameters. It is not only the blood group. It's not necessary to be a blood group is same. It can be different, but we'll be looking at some of the things based on that. And then matching donors, whether it is a fully matched, whether it is a off matched, or the matched donor is from the registry. There are various registries there, national, international. So we may collect the donors from there. So we will collect the stem cells, and we know that the leukemia is coming from the patient stem cell. So we will eradicate the patient stem cell by giving the chemoradiotherapy. And there is no stem cells in the patient because we wiped out by giving the chemoradiotherapy. So it has to be replaced by another stem cells. So that is called allo transplant. That is called allo stem cell transplant. Allo means getting the donor from outside.
Okay.
Auto transplant, that is autobiography, like that. Own stem cells. So that will be given, taken from the patient own stem cells before giving a chemotherapy.
Okay.
Then you give a chemotherapy, then you give back the stem cells which is collected from the patient. That is called auto transplant. Another one is allo transplant. And there are various indications are there for which it has to enter.
Right. So we've talked a lot about diseases, a lot about treatments, everything. Now I want to talk about you. I want to talk about some of your contributions. You can take this platform and talk about your achievements in the work that you've done for the last 30 odd years.
Good. So first of all, like those days, the concept is that you need to service to the society, which is not exactly goes in this current scenario, but I have done it. What I wanted to achieve as a doctor, I wanted to do the service to the society. To my consciousness, I have done my job very well. I'm happy at the end of the day. And being a specialist of hematology, what I have done it for the last 26 years, a lot of life I have saved through my treatment, including the stem cell transplantation, which is otherwise might have taken up the role of the patient. So which I could provide the stem cell transplantation, CAR T therapy, I could save the person. So I'm so happy to that. Yeah. In other ways, the patient would have died. So I could do it. Not all times. It's not by this one. It's a God's intervention. Through me, I could do the best of my knowledge to the society. That is it. I'm happy with what I'm doing it. And that's the reason I started this career. I'm happy with what I am so far cut.
Yeah. I'm pretty sure that a lot of people cannot say that that I'm happy at the end of the day after working. You ask some corporate people afterward.
In what context you are asking? You ask me in this career,
Yeah.
I'm happy.
Yeah. Oh, okay.
Whether it is a healthy or wealthy or whether it is that way, but I'm happy in professional way.
Yeah.
I'm doing the good what I'm doing it. I'm happy with what I'm doing it. That's the thing I want to.
Isn't that so nice to be saying that, because a lot of
I'm
people
happy.
cannot say that.
Yeah,
So
but the
kudos
thing
to
is,
you.
sometimes I may not satisfy all the time all the patients, because when things are not in the going in a right way, they may be upset,
Yeah.
which indirectly will be upsetting us. That is the things. So hurdles are always there, but you do your best to your consciousness. You can do the best.
Yes.
That is the things.
When we get diagnosed with a cancer, how do we check that our doctor is also, there is a rapport, as you said, there has to be a rapport that has been that should be created between the doctor and the patient. What makes a good doctor a good doctor? A doctor a good doctor?
The doctor, to become a good doctor, it's the patient's appreciation.
Yeah.
So it's a patient version that is. For that, you do your best to the patient in all aspects, not only in the treatment. Make them to understand in their own language. Have spent time for them to understand. You need to spend, and you treat every patient as your kith and kin, and that you attach the bond. That is what important. That is the things. And every patient has the right to know everything. It is their treatment. They have to know that. So you need to talk to them each and everything in detail. Side up, not only the effect, not only the side effects, financial implication, long-term toxicity. Do address the long-term toxicity, but do not threaten them.
Okay.
So those are the things we need to carry. All this.
That is how you see if your doctor is a good doctor.
It is a compliment by the patient
Yeah.
to the doctor.
Yes.
So good doctor is, I can say I'm a good doctor. Whether I am or not,
That has to be said
society
by
has to
doctor.
say that. That is the situation.
Anything you want to share with our audience regarding this that comes from your heart?
There's nothing that, as you rightly mentioned, hematologists are like, and but they are the specialities wherein they can treat some of the specialized cancers like a lymphoma, leukemias, myelomas, and as I mentioned to you, stem cell transplantation for various not only cancerous condition, non-cancerous conditions, wherein it is the only modality by which it can be cured. So when you born with immunity, inborn errors of immunity, something like that, these sort of the system can be addressed by the hematologist, and uh, you can have a sometimes you may not be able to arrive at the diagnosis whether it is a really, sometimes it may be difficult, sometimes one setting may not be able to sort out the issues, it has to be go in the again another setting, something like that. So that are the things. So through this, I am working currently in a Lisi Cancer Center. So we have started doing the stem cell transplantation as well as a CAR T therapy every programs. We have state of art facilities. So they can come to us anytime for any details,
Yes.
questions or discussions.
With that, my questions have come to an end. Thank you very much for coming here, taking this time, and having this conversation with us, simplifying a lot of big jargons, big words. And thank you very much. That's all I have to say.
Thank you so much. Have a nice day.
You too.
Bye bye.